Guys, so someone sent me their boyfriend's x-ray on TikTok and gave me permission to make some comments on what I see here. But first of all, what do you see? Do you see bone trauma or do you see soft tissue trauma? So there are obvious fractures. There are 5 fractures. So there's a proximal phalanx fracture. There's a second, third, fourth, and fifth metatarsal fracture. They're all displaced in the lateral direction. So in many cases with these injuries, especially if it's because of a crush injury to the foot, there's more extensive trauma to the soft tissues than the bone. With crush injuries, the provider needs to be cautious for a condition known as compartment syndrome. Compartment syndrome occurs when, because of the trauma, there's increased bleeding within compartments of the foot. There's so much pressure that blood flow can't really get into the foot and the muscles start to die. This can have both short-term and long-term consequences. From a short-term standpoint, because of death of muscle, components of the dead muscle get released into the bloodstream, which is very difficult for the kidneys to clear, and patients can go into renal failure. From a long-term standpoint, because the muscles are dying and just don't function, you can end up with long-term deformity and contractures of the toes. So with compartment syndrome, patients will have severe pain that's not relieved by pain medications, including narcotic opiate type medications. They'll complain of paresthesia. So what that means is like numbness and tingling and burning sensation in the foot. Additionally, the compartments will be very tense and not soft. And one other finding would be with passive stretch of the toes, it causes severe pain. So the treatment for compartment syndrome would be a fasciotomy or fasciotomies. So a number of incisions are placed on the foot to basically release that pressure. The incisions are left open, and I'm just talking hypothetics here, but if this patient experienced compartment syndrome, would probably try to reduce the fractures with some pins at the same time as the fasciotomies. At the end of the day, this is a very devastating injury, and you need to respect not only the bony or osseous injury, but most importantly, the soft tissue injury.